Hi there, this is Dr. Paul Firnhaber, and welcome to another edition of 10 Minutes of Truth. So tonight, I'm going to be discussing an article that came out in a journal called Current Rheumatology Reports, June of this year. The name of this article is as follows: Autonomic Nervous System Dysregulation and Osteoarthritis Pain, Mechanisms, Measurement, and Future Outlook. Quite a mouthful, I would say, for most people. This article has some massive implications for chiropractic and natural health care. So let me explain some of the things that they talk about in the article. First of all, they said that osteoarthritis is the 10th highest contributor to people that live with disability. So osteoarthritis is a major issue. Now, one of the aspects of osteoarthritis, and I've seen this in practice a lot, is that the amount of osteoarthritis that a person has isn't necessarily indicative of how much pain they have. So, for example, I've seen people with severe osteoarthritis in the spine that had very little pain, and I've seen people with very little or no osteoarthritis, and with lots of pain. So one of the things this article says is that when a joint begins to degenerate, so this would be a vertebral joint right here, and when this begins to degenerate, and you begin to get arthritis in a joint, and that will produce a chronic level of low-grade inflammation. Well, what this article says is there's an overlap with the autonomic nervous system. Now, the autonomic nervous system is a part of our nervous system that controls all the bodily functions that we don't even think about, like blood pressure, heart rate, breathing, digestion, things of that nature. And what they're saying here is that there's a specific overlap and a specific interaction between arthritic joints and the autonomic nervous system. Now, what happens is that when these joints get inflamed, and especially if they get painful, that engages the autonomic nervous system. And what it does is it down-regulates the parasympathetic part of the autonomic nervous system. Now, the parasympathetic part of the autonomic nervous system is basically sex, rest, and digest. So it's the part of the autonomic nervous system that works when we're relaxed, that when we're not under stress. And so when you have osteoarthritis in joints, that can actually down-regulate the parasympathetic nervous system so that that system is not working as properly as it should, which increases inflammation. So